first of all, were you ever diagnosed with having traumatic head injury?
Diagnosed? No.
But do you feel that you had one and just never were diagnosed correctly with it?
Yeah, they said, when I went to Fort Carson, they said that there was a good chance that something had happened, but there's no way to tell because they really didn't do any testing prior to. They did a baseline one, and what they found was most people just screwed off with it. So it had no real baseline.
Okay. And I'm sorry, it was a traumatic brain injury, not head injury. But
same thing.
okay. Do you remember any of the initial symptoms that you had that made you stop and think, this is not right?
Not really. It was more other people.
Other people were seeing it and bringing it to light to you?
Told me I needed to get help.
Okay.
It was not a, hey, I've kind of noticed that you're a little off. It's, you need to go get help.
When did that start happening?
Probably winter of 2011.
Okay, and what was your the dates that you were in Afghanistan?
October, early October to June from 2010 to 2011.
Okay. So roughly within at least 6 months of returning home. Do you think that there was anything specific, a specific event that may have triggered the post-traumatic stress disorder, or do you think it was just a combination of everything you've seen and experienced?
Most of it was one thing, but there are some things that are based more on the entire deployment.
Okay. So what are some of the symptoms that you experienced prior to getting help? Things that people brought up to you as an issue?
I was a lot more distant. I lost interest in a lot of the stuff I used to do. I had a lot of anger issues. I couldn't be in crowds. Explosions weren't and still aren't a big draw for me.
Okay. When did you notice, so you got back in June,
Mm-hmm.
and people were telling you in October-ish or that winter,
Yeah.
hey, you need to get help.
It was more of a one day thing. It all really happened in one day, and my wife and a few friends of mine that were deployed with me told me I need to go get help.
Do you mind going into detail about that day that they stepped up and said, hey, this is not normal?
Yeah. I don't really remember a lot of it. I blacked out. Started out in the morning, and I don't remember what exactly set it off, but I went in the span of about an hour and a half, drank about 8 or 9 beers, and proceeded to take everything in my house that was military related in any way, and it ended up in the basement in a corner in a pile. And then it scared my sister-in-law to the point where she called my wife, and she came home from work and found me in the back bedroom curled up in a ball crying. And I really didn't remember anything that had happened. But apparently during that time I had called a friend of mine who I was deployed with, but he was at work so he didn't answer. He called me the next day and was talking to me about the voicemail I left him. And so he got me hooked up with the psychiatrist that he was going to.
Okay. So within days of that happening, you were already talking to professional help. You didn't really spend much time on your own, so to speak, after that, trying to deal with it on your own. You went
No.
straight to a professional.
I've only been getting treatment for probably about a year now.
Okay. So for the last 2.5 years, you've been just trying to deal with it on your own. And what are some of the things that you've done in the way of self-treatment, like self-medication or...
I drank a lot. Like, to the point where every day I'd come home and I'd have a drink. Be it a mixed drink of some sort or just beer. But I'd always have something.
So currently, you're seeking treatment with a psychiatrist. What is he or she doing for you for your current treatment?
Well, it's been probably about 4 months since I've seen one, since I moved back here. But they have me on 150 milligrams of Zoloft for my anxiety and anxiety, mood swings, and that's all that's for. And then I'm on Prozozin, 4 milligrams for nightmares. They haven't tried anything else. They want me to go to group therapy, but I've told them no.
So, do you feel that being in the Army kind of makes it kind of a stigma about the PTSD? I mean, do they have it, is it kind of like the proverbial green curtain, so to speak, like they have with the police? You know, there's the blue curtain, nobody talks about stuff that happens. Is it kind of the same way? Is that just your choice, or is that kind of that's how the military is, you suck it up and just move on?
I mean, it just depends. The older guys, that's how they were brought up. You don't talk about it. The younger guys, they're more touchy-feely. They want to talk about it and share their feelings. And I mean, I've talked to Army psychologists, and they're the ones that kind of pushed everything along. But in my unit particularly, no one... There are a few guys that know I have it, but most of them don't. Because it's something I have to deal with, but it's not who I am. So I try to keep that pushed back.
Do you get your treatment through the VA or a private doctor?
Through the VA.
Okay. And do you personally, this is totally off the whole
There's no
true
such
facts,
thing. There's no such thing as off the record.
But, well, no, it's not a fact, it's more opinion at this point. But do you feel that the VA is giving you enough care and making sure that you're getting the treatment you need? That's been a big controversy, is that the VA is not there for their soldiers once they get home.
I mean, it all depends. Because if you push for it, they'll give it to you. Because, like me, I've been busy doing a lot of other stuff, so I haven't had the chance to get in there and get my treatment with the psychiatrist set back up. But when I was going, they always checked and made sure everything else was okay, asked questions.
Okay. So on a totally kind of a 360, prior to your issues with Afghanistan and whatnot, had you ever thought about committing suicide? Other than your typical teenage, oh, my girlfriend left me and I can't go on without her.
No.
What about now that you're home?
Now?
Prior to treatment, but after you came home, was that something that was kind of one of those options on the plate?
Yeah.
Has that subsided since you started to seek treatment?
Yeah.
So you do think that's helped? Okay. if there's one thing that you would want anybody to know about post-traumatic stress disorder, what would that one thing be?
I don't know. We're not different. Because that's something I've noticed. Because I've lost jobs because of it. Because people don't understand, and they just assume that if you've got PTSD, you're gonna snap and kill everybody. And most of us aren't like that. Like mine, I got mine because my buddy died. It's not because I got into a firefight and I was scared or anything. It's because my buddy got shot and he died right in front of me. So people thinking that we're going to go crazy and kill everyone isn't true. Yeah, you get those bad eggs, but you have that anywhere.
So to you, PTSD is just like having a depression or bipolar, or
Yeah.
it's just something that with treatment every day is just another day.
Yeah.
All right.